So this next clip is just a little bit more detail of the anatomy of the nerve block that I did. This is actually a variation of that nerve block called an infraclavicular, which means below the clavicle. I sometimes do that block in patients who have different anatomy. But you can see the blue circle is a vein, the red circle is an artery, those yellow circles are the nerves that always like to live around blood vessels, and we placed the numbing medicine around those 3 yellow circles to basically numb the entire arm. This image is the same one we just showed live on the ultrasound. This is the supraclavicular, which is a fancy word for above the clavicle. And in this view, as I explained earlier, you see an artery in red, and in yellow, outlined in yellow, are the bundles of nerves that live around that artery. You see the white line is the rib, and again, we place that medication precisely around that nerve bundle, making sure that we stay away from any vital structures there.
And the take-home message with this, well, you're going to show an injection technique now, but if I can talk while that's beginning. The take-home message for the viewer is that although they may not appreciate the confusing anatomy on that ultrasound, we do know it. And it's our knowledge base with this and how to interpret that anatomy that we can guarantee that we're putting that needle in the exact correct spot.
That's right. This is just if I were to do this nerve block live in the operating room, now you can actually see a needle coming into view, coming in from the right-hand side of the screen. You'll see a bright white line, which is the needle, as it's approaching that artery, and you can now see the injection of local anesthetic floating those nerve bundles, which looks like honeycomb, a cluster of black circles. Those are the nerves that are being soaked with numbing medicine to make that patient their arm numb and comfortable for surgery. And as you can tell, the needle tip it's barely touching those nerves. It's not going into them, it's just barely touching them right outside of those nerves.